Good day. Today we are starting our last lecture on the history of medicine. It is the 9th lection. So, as you know, that you study in the Ulyanovsk State University. It is placed in Ulyanovsk region. When it was founded, it was called Simbirsk. So today's theme is the healthcare of Simbirsk gubernia and the Ulyanovsk region. On the 7th January 1648, Tsar Alexei Mikhailovich appointed and Boyars centered. The country's Borgan Matveyev Khito sent to lower cities for protect of the Russian border from the raids of the Normans and to build new cities and frontiers fortress from the Beres River to the Volga River. So Simbirsk was built in 1648-1654. This how it looked like in the middle of the 18th century. The first Simbirsk Kremlin. It was demolished in the last quarter of the 18th century. Simbirsk after the fire. The order of public contact, which operated healthcare, was opened in Simbirsk in 1780. Before this, medical care by the patient appeared certain doctors and just doctors. In records of the order for 1660, it was noted that there was a doctor, Ivan Igumenev, who was on the state providing just as other employer. Means some health service in Simbirsk were already organized. Perhaps Ivan Igumenovich was the first doctor of Simbirsk. In 1730, in the hospital at the temple of Spassky convent was organized. Later, there was a hospital temple. The monastery occupied the territory, which is limited to the real street, Bebel, Soviet, Karl Marx, and Pozner Lane. Here, the almost and school for orphan girls were organized. Their nuns, some governors, freemen were buried. In 1786, due to the new administrative division of Russia, it was founded Simbirsk province. First hospital in Simbirsk was opened in 1782. In 1801, Simbirsk nobles, after accession to the throne of Alexander I, built a two-story hospital named Alexander. The emperor expressed his gratitude for it. The city received a gold commemorative medal. Karl Rudolf was the first chief physician of the Alexander Hospital. This building is saved until now, and it also is functioning, and it is the central hospital of Ulyanovsk. Of course, they were built in other buildings, more modern, but this was saved. This is how it looks like now. Simbirsk, during the territorial reform, was considered the most backward in Central Russia. During this period, most progressive role in public health has played a Dr. Alexander Kadyan. Alexander Kadyan introduced antiseptics in 1881. in Simbirsk District Hospital. On his initiative, a card file of patients was established in the hospital. He organized monitoring of patients after their discharge from the hospital. He held a deep analysis of all surgical operations in Simbirsk District Hospital for the years 85-86. He did his doctoral dissertation on the topic materials for the study of architecture of the foot. He had great authority. He was called the people's doctor. He was a doctor of the Ulyanov family. Only in 1880 were started receiving patients by different specialists. For this purpose, each compartment separated room. Hospitals were not in the villages. Only in the year 1872-73, hospitals for 25 beds opened in the villages Nagatkina, Lagay, and Solje Tashla. Infectious disease, malaria, cholera, ranks first among the disease of country people. Cholera epidemics in Simbirsk are registered in 1830, 1846, 1866, 1892. Epidemics in 1892 was the heaviest. It was preceded by hunger. Usually, cholera was brought to Simbirsk from Lower Volga, from Astrakhan. There was a high incidence and infant mortality due to poor material conditions of the people. Simbirsk province died 328 children of 1,000 births. Nursery shelters were opened in the 60 villages of Simbirsk province. Day nursery was usually arranged as schools. A day nursery was visited by about 2,500 children. The territorial doctor or the paramedic conducted medical supervision. A day nursery was headed by teachers, nurses, and is frequent also priests. As a result of it, children's incidence decreased. The fight against infectious disease. One of important actions for fight against infectious disease was the organization of the medical observation or medical food points in the crowds. Medical observation points were organized on piers of the cities of Simbirsk, Syzrin, Singilei, and later at the railway station of the Alater and Inza. Points were very simple. In the same place, gave tea with sugar and bread. Medical care was provided free of charge. Sick people were sent from the points to hospital. Patients with cholera immediately isolated, point cared, and disinfected. Doctors, paramedics, and medical students headed points. Points played a positive role in the prevention of infectious disease, especially cholera. In Simbirsk was opened psychiatric hospital on money resource of Senator Karamzin, the son of a famous historian and writer Nikolai Karamzin. Vasily Alexandrovich Kaposov was the first head of the hospital. Kaposov entered hydrotherapy, walk therapy for psychiatric patients. Were organized a Kuznetsk and Shur workshop for men and sewing for women. Kaposov was the great psychologist, was a master of hypnosis and had big power of suggestion. He paid attention to leisure patients. He organized literary practice. He was created a large chair and later this theater. Kaposov paid great attention to social activities. He was a member of the first Congress of Russian Psychiatrics, participant of International Congress in Paris, Madrid, Budapest. As a member of the Paris Society of Clinical. On his saving, he built a house for 50 beds for patients. Now it is named Kaposov. Selitsky, the graduate of the Kazan University, the pupil of the Professor Bekhterev, was a famous figure in psychiatry of that time. Selitsky carried out extensive public work. From 1905 to 1911, he was the chairman of Simbirsk Society of Doctors. In the psychiatric hospital, he was in charge of the medical section and was in charge of the forensic psychiatric examination. Dmitry Ulyanov, doctor since spring 1905, held the position of sanitary doctor. Organized health service in the province. He studied all the cholera epidemic which occurred during those years. He took a deep analysis and found errors in the fight against the epidemic. In his work, he pointed to the role of water quality in the development of a cholera epidemic. He noted that in under area whose population used water from the wellspring, cholera was not. About the need, Dmitry Ilyich Ulyanov set specific objectives of public health care service. About the need to study the water supply, health monitoring of schools and periodic inspectors of students, health monitoring of industrial plants for the purpose of specific the method against pollution of river. The memorial board is established on the building of the country government, where Dmitry Ivanovich Ulyanov often worked in 1905-1906. Zinoy Petrovich Solovyev, theorist and organizer of Soviet healthcare, professor of social hygiene, had a military public healthcare service of Red Army, chairman of the Russian Society of the Red Cross. He was born on November the 10th in Grodno. He studied in the Simbirsk Gymnasium. In 1897, he arrived on medical faculty of Kazan University. In 1905, he went to Manchuria together with a group of the Russian Society of the Red Cross, where he gave help to patients and wounded on Russian-Japanese war. Some years he works as the territorial doctor in Sibirsk and Saratov province. He paid much attention to sanitary education and prevention in fight against tuberculosis in Russia. He called for mass fight against this serious illness. Andrei Lvovich Polenov, Russian science surgeon, founder of traumatology and neurosurgery. In 1896, Polenov graduated from Army Medical College, worked as a doctor in the city of Orel, and then in the Naval Hospital in Kronstadt. Polenov trained in France and Switzerland. At the beginning of 1911, Polenov resigned, and the same year was elected a senior physician, Simbirsk Provincial District Hospital. Polenov made a fundamental reorganization of the hospital. It was rebuilt, expanded, and re-equipped with advanced clinical equipment. Vivarium was established at the hospital, where doctors made research. The range of surgical activity, Polenov was great. He and his pupils operated on all organs of the body except heart. At that time, they performed difficult surgery on the gastrointestinal tract, resection of rectal cancer, craniotomy for injuries and hemorrhage, surgery on the chest and legs. Under the chairmanship of Polenov, activity of Society of Simbirsk doctors developed. Once a month, Polenov held a scientific conference of doctors. These Polenovsky conferences were very popular in the city and the province. Patients, röntgenograms, color photos were shown at conference. All staff of hospital was involved in scientific work. Since August of the 1911, reports of conference began to be published in work of Simbirsk Province Hospital. In 1914, Polenov was transferred to service to Petrograd, where subsequently there he founded first Institute of Neurosurgery. In October 1914, the leading surgeon of Simbirsk Province Hospital became Vladimir Semenovich Levit. Levit carried out difficult operations on abdomen organs and also obstetric of gynecological operations. He published his book To a Question of a Cancer of the Stomach and Palliative Operations, and presented this book to the Kazan University, where he was entitled the Doctor of Medicine. Since 1926, Levit managed surgical clinics of the Second Moscow Medical Institute. In days of the Great Patriotic War, it had a rank of the Major General of Medical Service and was the Deputy Chief Surgeon of Army Burdenko. The huge role in the origin and formation of the ophthalmology service in Ulyanovsk was played by Grigory Ivanovich Surov. In 1911, he created eye department in Simbirsk Province Hospital. He exercised the doctoral dissertation on to a question of change of a cornea. In pre-revolutionary time, he was one of active members of Society of Guardianship Blind, organized in Simbirsk school shelters for blind children. In the period of Great Patriotic War, he headed the regional hospital of Ulyanovsk. He was the first in Ulyanovsk region, was entitled the Honored Doctor. One of the streets in Ulyanovsk is called by name of Surov. On November 1918, the Special Public Health Department in Simbirsk was organized. In December 1918, heavy epidemic of parasitic typhus. For fight against typhus, the Provincial Extraordinary Commission, under the leadership of the chairman of Simbirsk Province Executive Committee, Mikhail Andreevich Gimov, was created. The extraordinary commissions were created in Simbirsk. The strict account of patients was entered. The most strict measures for isolation were taken. In 1918-1920, 7 health officers worked in Simbirsk. They took a water supply system, the sewerage under rigid control, organized water chlorization, bacteriological research, established sanitary control over bakeries, table, and tea. Sanitary parts at the enterprises and among inhabitants were created. During this period, of hospital were opened in the villages of Timoshkina, Yezykova, Profit, and also at a large railway station of Inza. In 1818, in Ulyanovsk, the central working outpatient clinic, nowadays Polyclinic number 1, with offices and all specialists opened, and the clinical laboratory local service is established. In 1920, the first children's hospital was opened. The doctor of medicine, Semyon Grigorievich Met, was her first senior doctor. Fight against social disease was headed by the qualified doctor of Simbirsk Province Hospital, Sergei Nikolaevich Yakovlev. At first, the isolated offices were open for patients with tuberculosis and skin disease. In 1820, tubercular sanatorium were opened in Simbirsk, Alatyr, and a railway station of Inza. In 1828, the Ulyanovsk province was transformed into a district. Hospital care in district were provided in 36 hospitals, including 8 in Ulyanovsk. People received outpatient care in 52 institutions. From them, 34 outpatient clinics were at hospitals and 18 independent outpatient clinics of medical type. 2 anti-tubercular clinics functioned. Sanitary services in the area carried 11 doctors. Training courses of rural doctors were organized. There were regional and inter-district conferences. Inspectors check of rural hospital practiced. In 1930, the Ulyanovsk region was eliminated. Ulyanovsk became a city of Samara region. From 1930 to 1942, changes in the medical network and public health service happened at the small. The Zavolsky Hospital, the building of consultation in the Zavolsky district of the city, 5-day nursery, and during this time constructed. In 1938, the maternity hospital on 13 beds is opened. And during the Great Patriotic War, on the territory of the Ulyanovsk region was formed and deployed several evacuation hospitals, where 133 treated 1,000 of wounded and sick. The great contribution to the practical activities of the hospitals made by the Science of Voronezh Medical Institute, evacuated to Ulyanovsk in 1942. Among them, the chief surgeon, Professor Management Sokolov, and Professor Nesterov, Babarov, and Kraul. From July 1942, evacuation hospitals take daily military hospital trains with the wounded. During the war, the evacuation hospitals on average 70% cured the sick and wounded. During the war, 50% of staff of physicians of the Ulyanovsk region was mobilized into the army. Many doctors have shown themselves heroic in the Great Patriotic War. One of them was Ulyanovsk physician Fyodor Mikhailovich Mikhailov. He died in 1942. Mikhailov posthumously awarded the title Hero of the Soviet Union. It is named in honor of one of the streets in Ulyanovsk, Street Dr. Mikhailov. In 1943, the Ulyanovsk region was formed. New pages in the history of healthcare from this point began. Requirements to healthcare raised. In many areas, new buildings of hospital began to build. At large plants of Ulyanovsk sanitary parts with hospitals were organized. 4 maternity hospitals and 2 city hospitals are open. The regional hospital was expanded up to 700 beds. The special role in development of healthcare of area was played by Congress of Rural and District Doctors. Big progress was observed. In 1971-1975, over 11 million rubles were spent for healthcare. In 1977, in area there was 118 medical institutes, 146 outpatient and polyclinics, about 600 FAPs, 100 female consultation and children's polyclinic, 1,005 beds for pregnant women and women in labor were developed. Much attention is paid to development of highly skilled specialized therapeutic health. Undorovsky Health Local Hospital, 125 years. The first manager, the territorial doctor Pavel Semyonovich Petrov. He promoted cancellation of payment for treatment, obligatory smallpox inocular were entered. He organized public health service in the province. Artemy Vasilyevich Vorobyev. Since 1811, he worked in Undorovsky local hospital. At this time in hospital, the infectious office is opened. Already at that time, he treated urological patients with Undorovsky mineral water. He carried out vaccination for elimination of smallpox. In 1805, he opened National Library in Undorovsk. He promoted introduction of free school food in connection with the mass incidents of scurvy. At Undorovsky Hospital, The meteorological station on his initiative is constructed. In 1880, the name of the Dr. Воробьев is appropriated to Underovsky local hospital. Anna Mikhailovna Asmaga. For 40 years, she was the chief physician of Underovsky Hospital. Under her management, the hospital turned into a well-equipped medical institution with a physical therapy officer, laboratory, and X-ray room. Wide recognition was gained by treatment by Underovsky mineral water. For big merit in healthcare, in 1966, Asmaga gave the rank of the honored doctor. She was awarded the Order of the Labor Red Banner and the award-honored sign. One of streets in Ulyanovsk is called by the name of Dr. Asmago. On the building of Polyclinic, the memorial board is established. The curative force of Underovsky source was known long ago. Researches of mineral water and its influence on organism at various diseases were rapidly conducted. However, long time wasn't possible to draw certain conclusions. The big role in promotion and further research of Underovsky mineral water belongs to the honored Dr. Evgeny Mikhailovich Chuchkalov. He is the author of many scientific works. Since 1948, he worked in a public health department, then the chief physician of Regional Hospital No. 2, and the chief physician of Sanatorium Dispensary Volga-Jaws. He invented a treatment of stomach ulcer over 12 pulmonary gut ultrasound via the endoscope. In 1971, he is awarded the honor sign. On his initiative, the plant of food of mineral water sanatorium of Lenin were constructed. With active participation of Chuchkalov, the Ulyanovsk Regional Social and Rehabilitation Center, the country's first rehabilitation center of veterans of war and work, was constructed. At the initiative of Regional Council of Veterans named Chuchkalov is appropriated to the Ulyanovsk Center Regional Social Rehabilitation. In 1960, in Underovsky, the gastroenteric department on 15 beds was opened. Indications for treatment were diseases of gullet, stomach, intestine, bilions, way, kidneys, and urinary tracts, chronic hepatitis, cholecystitis. For the first 20 years of existence of gastroenterological department, about 10,000 people were treated. Popularity of Underovsky local hospital considerably increased. Underovsky Sanatorium was opened. It gained a wide popularity in Russia. Medical faculty. In 1881, in Ulyanovsk, the medical faculty of branch of Moscow State University was opened. It was headed by Tofik Bektimirov. Tofik Ziyedinovich Bektimirov. The medical faculty works in structure of university since 1881. Associate Professor Tofik Ziyedinovich Bektimirov became the first dean of faculty. From 1995 to 2001, faculty was headed by Professor Larisa Ignatievna Trubnikova. From 2001 to 2014, the faculty was headed by Professor Vasily Ivanovich Gorpunov, and with 2014, Dean of Faculty Valery Viktorovich Neivych. In 2011, the name Bektimirova was appropriated to medical faculty. This is building where the medical faculty is based until now. At faculty, there are 17 chairs, 32 doctors of science, 16 professors, 69 candidates of science, 54 senior lecturers, 5 science of faculty are elected full members of the Russian Academy of Natural Science. Among teachers of faculty of 5 honored doctors of the Russian Federation, 2 honored workers of the high school, 8 honorable workers of higher education. For training of doctors, the library works with font about 100,000 volumes. 2 computer classes, Vivarium, the Center of Telemedicine, are used. Clinical learning is conducted on 13 clinical bases. At faculty, 70 to 75 graduate students are trained. 52 candidates and 11 doctoral dissertations are only over the last 5 years defended. Today, perhaps, will become not less important in the history of healthcare of Ulyanovsk region. So this is all lectures on your course. So it is the end of the last lecture. Those students who have listened all 9 lectures will get the credit automatically. The lectures also available in a record, so you may listen them in record. The credit will be on your credit week. So goodbye to everybody.